One of the most complicated topics when it comes to adulting is health insurance. Today, I decided to get some advice from an expert. So we have Greta Latvyte from the Family Resource Network, and she is a health insurance navigator. So she's a bit of an expert on the topic, and I'm going to ask her some of the questions that can be confusing about health insurance. Thank you for joining us today, Greta.
Yes, thank you for having me.
So one of the main questions is, I'm young, I'm healthy. Why should I get health insurance?
Yeah, that's a really good question. So health insurance provides you with preventative care at no cost. And this includes procedures like the annual checkup, immunizations, as well as certain tests and screenings before you meet your deductible. And health insurance also protects you from unexpected high medical costs.
Okay, so that's health insurance, but say I have a cavity or I need eyeglasses, dental and vision. How could I go about that?
So dental and vision are separate plans. Dental and vision coverage are included through New Jersey Family Care Plans, which is our state's Medicaid program. If you do not qualify for Medicaid/NJ Family Care and need to get coverage through the Get Covered NJ Marketplace, dental and vision insurance are separate coverages. So you would need to secure these plans through an independent provider. So vision would be through an independent provider, and dental with the marketplace, you're able to choose a plan through there. So the New Jersey Health Insurance Marketplace, Get Covered NJ, does have dental plans, meaning that more options for affordable plans and discounts are available through there.
When it comes to the health insurance, when I'm signing up in a plan, there's all of these different words that I struggle to be familiar with. So I'm sure that somebody signing up for health insurance the first time might find them unfamiliar. The one you hear the most is a premium. So what is a premium?
So basically, a premium is just a fancy word for your monthly payment for your insurance plan.
Okay. And then the other one will list the premium, and then under that is a deductible.
So deductible is the amount you pay for healthcare services before your health insurance plan starts to pay.
Okay. And then lastly, a copay. That's when I go to see a doctor, right?
Correct. So typically it's a fixed amount you pay for healthcare services after you've reached your deductible. So for example, say on your summary of benefits, it says if your primary care office charges $100 for an office visit without insurance, and then your health insurance plan copay is $10. So that's how much you would pay once you would reach your deductible.
All right. And then some plans I see have this, some plans don't. So what is co-insurance?
So this is typically also displayed as a percentage on your health insurance summary of benefits. This percentage represents the cost of covered health care services that you pay. So for example, if you see a 20% co-insurance, then this means you're responsible for 20% of the medical costs. And then your health insurance would pay for the remainder 80%.
Okay. And then lastly, an out-of-pocket maximum. What is that? That's usually a big number sometimes.
Yeah, so that will be the biggest number on your summary of benefits that you will see. So this amount is the most you will have to pay for your covered services during your plan's time span, which is typically a year. Once you reach 100% of your out-of-pocket maximum amount, your health insurance plan will pay 100% of the cost of covered benefits.
I hear a lot of talk about there'll be different numbers, different co-pays, co-insurance, et cetera, if something's in network versus when it's out of network. So what does that mean exactly?
Yeah, so when a hospital or doctor's office accepts your health insurance, the term is that the medical provider is in network. And typically, if you go see someone who is in network, it's going to be much more affordable for you. If the hospital or doctor's office does not accept your health insurance, this is called out of network. And then this varies based on the health insurance plan and which facilities they work with.
So sometimes when I go to set up an appointment or something like that, the doctor or somebody else will say that I'll need a referral. And what is that for insurance?
So a referral is typically either a written or an electronic order from a primary doctor for you to see a specialist or to get a certain medical service.
Mhm.
Some plans do require a referral and some don't. But the ones that do require a referral, they will be satisfied with that referral, and you'll be able to see the provider and get the charge for the specialist with the price with your insurance.
Okay, good. So make sure you get that referral. So the list of the plans, we've covered the nuts and bolts of them. And then I know that there are different types of plans. The main ones that I hear about are HMO and PPO. Let's break down what those two are.
Yeah, so HMO stands for Health Maintenance Organization, and these plans typically have smaller networks of providers, and you must visit with these providers to receive coverage. An HMO plan are typically cheaper than PPO because of the smaller network. A PPO plan, that stands for Preferred Provider Organization. So these plans allow you to visit whatever in-network physician or healthcare provider you wish without first requiring a referral from a primary care physician.
Okay, so
And then for both plans, you pay less by seeing the providers that belong in your network.
okay, and so we're seeing like how the referrals and everything come into play. So sometimes on the plans, I also see listed an HSA and an HRA. So what are these two things?
An HSA is a health savings account, and this is an employee-owned savings account that allows you to put aside pre-tax money to pay for qualified medical expenses. You own your HSA and all your funds in it. So if you switch jobs, your HSA comes with you.
Mm.
So you basically get like a credit card that you're able to take with you to your appointments and use as a payment for the services that you receive. And again, preventative care is free. So make sure, you're not getting charged when you're going for your annual checkup for immunizations or any other type of screenings. And then an HRA is a health reimbursement arrangement, which is an employer-owned account. And this account will remain with your employer once an employee departs from the company.
Okay, so how do I go about getting health insurance? What are my different paths? I know that I have it from my job, so that's one path, right?
Correct. Yeah. So that is an employer insurance. So during open enrollment that your job hosts, or once you join a new job, you qualify for a special enrollment period. So your new employer may require 60 to 90 days of employment prior to being eligible for health insurance plan through their company or organization. But yes, one of the ways is employer-based insurance. Another way is directly from an insurance company. So that would be contacting a specific company and applying through them directly. You would reach out to the company and fill out an application with them. But I do want to add that you might miss out on advanced premium tax credits and New Jersey health savings offered to New Jerseyans if they apply through the Get Covered NJ marketplace.
Mm.
And that leads us into our next option, which is through the Get Covered NJ marketplace. So this is our state's marketplace. Previously, New Jerseyans were using healthcare.gov, which is a nationwide platform. And then in 2020, New Jersey opened their own affordable healthcare platform. So it is the only health insurance marketplace in our state. You can qualify for financial assistance to help lower costs of premiums and out-of-pocket costs. So I would highly recommend applying through Get Covered NJ first. The income parameters have been expanded in New Jersey. So you might not qualify for a lot, you might qualify for a little, or you might be paying a very low amount. You won't know until you apply, and then you'll get your results right away.
Yeah, absolutely. So that's a good option to do if you can't get your health insurance through your employment, or if you are employed, but it's part-time, so they don't offer that. So say I'm still in school, what would be my options there?
Yeah, so some universities and colleges do offer health insurance plans. And then this highly varies from the university and it's really case by case. So this information can be found out through your school's health services department, or you can reach out to a health insurance navigator with the Family Resource Network, and we can work together to figure out whether your school has this option. And then the last way to acquire health insurance. So there's Medicare, Medicaid, and then CHIP. So CHIP is the Children's Health Insurance Program, and that also lives under Medicaid, aka New Jersey Family Care. So first, let's discuss Medicare. Medicare is the federal health insurance program for individuals over 65 years of age, certain younger people with disabilities, and individuals with end-stage renal disease. And it is also recommended to start the application process for Medicare 3 months prior to turning 65 years old. Medicaid/New Jersey Family Care and CHIP, which is the Children's Health Insurance Program. So these are state and federal programs that provide coverage to New Jerseyans with limited incomes and some people with disabilities. The CHIP program is specifically for individuals under 18 years old. And I do want to mention you can enroll in Medicaid, New Jersey Family Care, CHIP year-round. So as I mentioned before, Get Covered NJ and employers have certain open enrollment periods for health insurance. Get Covered NJ is typically November 1st to December 31st, with sometimes extended deadlines. But New Jersey Family Care / our state's Medicaid, you can apply year-round. So you can find out more information by reaching out to a health insurance navigator, and we can walk you through the process of that.
Okay, so what are advanced premium tax credits and NJ health savings?
Yeah, so advanced premium tax credits is a tax credit you can take in advance to lower your monthly health insurance payment, aka your premium. These funds do not need to be paid back and are calculated based on income and household size. You will need to reconcile these tax credits on your tax form, and you will be receiving a 1095-A form from Get Covered NJ to complete this process. And I just want to add real quick that the advanced premium tax credits are offered through the Get Covered NJ platform. Now, the next financial assistance tool is the New Jersey Health Savings Funds. So this is a state subsidy, which will also lower the cost of health insurance when applying for coverage through Get Covered NJ. And just as a note, if at the end of the year you've taken more advanced premium tax credits and New Jersey Health Savings Funds in advance than you're due based on your final income, you will have to pay back the excess when you file your federal tax return. If you've taken less than you qualify for, you'll get the difference back. That's why it's so important to report any changes as they come up during the year. So if you get a new job and your income increases, or if something else changes and that affects your income, it is very important to update your application, which you can do online or by reaching out to a health insurance navigator. We can do that online or reach out to Get Covered NJ and make sure that information is recorded so you avoid any surprise surcharges during the tax season when you do file.
Absolutely, that's great advice. So say that I think I qualify for Medicaid, how would I go about applying for that?
Yeah, so Medicaid is available for New Jerseyans with limited incomes and people with certain disabilities. So the Medicaid / New Jersey Family Care income parameters can be found on njfamilycare.org. And in addition, once you apply for coverage through Get Covered NJ, and if based on your income you qualify for Medicaid, your application will be directly sent over to their system. So there's two ways you can apply for Medicaid. So one is filling out one application with Get Covered NJ, and then if you qualify for Medicaid, your application will be sent over, or you can directly apply to New Jersey Family Care /Medicaid on their website, which is njfamilycare.org.
Okay, awesome. Greta, you've been a great help, and I know that you're a health insurance navigator, but I don't really know what that entails. So how did you become such an expert in this topic?
Yeah, great question. So health insurance navigators are trained and certified individuals who are able to help you look for coverage options through the marketplace, the Get Covered NJ marketplace, and Medicaid New Jersey Family Care. We work with the Department of Banking and Insurance, and that's who trains us. So we are trained to assist with completing eligibility and enrollment forms, submitting additional documents that might be required by the Get Covered NJ or Medicaid. And we really try to, we are unbiased, so we don't work with any specific health insurances. We connect people to the options that are available in New Jersey based on their needs and what they're looking for. We also connect individuals with provider directories. So once they do choose a plan, they can start looking for a PCP or a specialist that they need to see. And, making sure everyone is in their area and it's easily accessible, and, there's transportation to these offices. And also FRN, the Family Resource Network, has bilingual navigators. So we have navigators that speak Spanish, Russian, and Lithuanian. And you can make an appointment year-round to ask questions, or to, if you've decided you want to complete an application, then we can do that too. But you can really reach out with any type of questions about health insurance. And we can be reached at 800-355-0271. And then we also have an email address that you can reach us at, which is frnnavigator@familyresourcenetwork.org. And then we also have a website which contains some webinars that our navigators have done about coverage to care and about open enrollment. And our website is www.frnnavigator.org.
Awesome. Wow. I had no idea until I met you that this service existed. So if I were to call a health insurance navigator, how would they be helping me?
Yeah, so once you reach out, we would schedule an appointment that works with your schedule. And it depends if you're just getting warmed up to the idea of health insurance. So we talk about the different options that are available. If you're ready to apply, we would apply. And then we really follow our clients through the whole process until they're comfortable with reaching out to a provider and making those appointments. So we're not going to apply and then just leave you hanging. You're always, you will get the navigator's agency cell phone, and you can always schedule time to follow up or ask any questions.
So this is a great service. So I have to ask, is there a cost for this?
So this is a free service, actually, since we do work with the state, with the Department of Banking and Insurance on this. This is a free service to get New Jersey and signed up and covered. So yeah, absolutely free.
Okay, wonderful. And do I need any sort of qualifications, like to show a certain income level or be a certain age?
No, so the income parameters would just be, once we are applying, you would have to share that information with the health insurance navigator that's assisting you, along with like household information, your address and phone number. And I do want to mention everything is confidential, and your information, your private information, will be safe with the navigator that is assisting you. But to reach out to us, you don't need to have a certain income level or be a certain age. I've assisted college students, entrepreneurs. I've assisted people transitioning from Get Covered in J into Medicare. So we really support people across the lifespan in New Jersey.
I think that we have a much clearer picture of what health insurance is and how to get it today. So thank you so much for joining us, and I really appreciate it.
Oh, thank you so much. Thank you so much for having me.
Support public libraries. Like, share, and subscribe for more great videos.